Good morning, everyone. Today on Perspectives, we continue to tackle the issues involving the COVID-19 pandemic. To maintain social distancing, our experts today will not be in the studio. Instead, we will be reaching out to them remotely as we examine the question, COVID-19, where are we now? Now, as we begin this second week examining the effects of the coronavirus pandemic, we turn from our community of health workers to those who have lost their jobs and businesses to the pandemic. According to the U.S. Bureau of Labor Statistics, the national unemployment rate increased by more than 10 percentage points to almost 15% in April of this year. Now, this is the highest and largest over-the-month increase in the history of the United States since 1948. As we examine the number of unemployed persons, according to the federal government, rose from 15.9 million to more than 23 million last month. Now let's break it down even further if we can. Who has lost their job? Again, citing the U.S. Department of Labor, while unemployment rates rose sharply among all age groups, those greatly affected are close to 32% of teenagers, more than 15% of women workers, and roughly 17% of African Americans. The highest, 19% of Hispanic Americans lost their jobs. It is actually a no-brainer for our business community, the civic and political leaders, that America needs to get working again. But how to do that and still protect citizens from a virus that kills so easily? Joining us today, Mobile Mayor Sandy Stimpson and Mobile County Commissioner Merceria Ludgood. Both local, county, and state agencies have worked closely together to stave off this vicious pandemic. But now comes a very tough question. How can we get our local economy moving again? Well, stay with us this morning as we talk with these community leaders. Perspectives continues after this commercial break. Welcome back to Perspectives, and now we are joined by Mayor Sandy Stimpson, the mayor of Mobile. And Mayor Stimpson, thanks for spending some moments with us today.
Glad to be here.
As we look at the numbers and where we are now, Mobile County for the last 2 or 3 weeks has been at the top of the pace with the number of COVID-19 cases and sadly the number of deaths in the state of Alabama. As we look at these numbers, how do you see where the county and the city are now? Were you expecting something like this to happen?
So from an expectation standpoint, Eric, I'd say no, that this wasn't something that was expected. But I think that if we try to come and give a synopsis of where we are right today, I think that we're much more knowledgeable. I mean, there's no doubt about it. You know, to begin with, there was a lot of scrambling to figure out exactly what to do. I think that now we know what to do. And as history is written about what we've learned and what we should do in the future, I think that we recognize that we probably need to do a better job of protecting our most vulnerable and those at the greatest risk and those that are individuals that have underlying health issues, as well as living in confined spaces like nursing homes and the jail and so forth.
When you look at that breakdown of the numbers, I'm sure you watch that every day, and of course as the reports come out from your county health officers, is it an issue of what you just mentioned, those confined and those with pre-existing conditions versus the general population? And in the deaths, sadly, most of them, the majority, have been over the age of 65, and I believe only one person has died under the age of 50.
That's correct. You know, it's exactly right. And Eric, I'd kind of pivot from there and just say I left a meeting an hour ago. It was maybe the most informative meeting that we've had between the county, the health department, and the mayor's office, along with Synergy Labs and the city's innovation team. And we really did start looking at the data, trying to determine how can it maybe be presented in a fashion that is more useful. And I know Commissioner Ludgood and I share the same sentiment, and that was that it was an excellent meeting. And I think a week from now, we'll be looking at data in a different way than we have been looking at it, and be able to use it in a manner that's going to be more helpful.
When you look at those numbers, one of the concerns that some have that it's targeting, it seems, certain ethnic groups in the community, as well as we already mentioned the age group and pre-existing conditions. How are you looking at that as far as what the city needs to do to make a difference?
So to me, part of that goes back to probably a belief of who was vulnerable initially. There were a lot of, I think, people that just thought it couldn't happen to them or they wouldn't be impacted, that they could continue to go to church and continue to have social gatherings. And those that just ignored some of the advice, they're the ones that probably got ill. And so there's been a concerted effort by community leaders to make sure that everybody understands that regardless of what you look like, that you are vulnerable. And I think that that's starting to catch on now, but I think it was slow coming out of the gate.
When you look at that issue, how do we get that point across? Because I saw someone this week that you and I both know very well who was in a major, large grocery store, and they came in, even though the sign said, please wear a mask, and they were in there, and somebody that we both know very well. How do you get that message across to them?
Sadly, there's just some people that are not going to abide by the best recommendations or best practices. And, we can't be a police state and expect everybody to do it. You can't have an enforcement to make people do it. It's just unfortunate, but that's the society that we live in. Now
that we've re-entered, and I say entered the stage of reopening our businesses, what are you expecting? I know in one of the conferences you had last week, you were told by the county health officer, Dr. Eichel, that anywhere from 3 to 10 days we should know where we are as relates to reopening the different businesses as well as other types of establishments in our community. Where are we now as you're looking back with a few days under your belt?
So I really haven't seen a change that would indicate that the gradual reopening that we've done, has been detrimental. Now, today we were not focusing on yesterday's numbers, so maybe something's come out just very recently that we haven't focused on. But I'm not uncomfortable based on the numbers that we're seeing right now.
So what are you telling the business community? I know that's one of the concerns that we have not only locally but nationally about getting businesses open again, and especially when we talk about restaurants and other types of businesses like salons and barbershops where people are in a close, confined area.
So I think that the business owners really recognize it already, and that is that they have a responsibility to make their clients and customers feel safe. And if they do, those clients and customers will, frequent their establishments. But if they don't, they're going to find themselves losing business to those who are trying to be more careful. So my encouragement to the business owners is to, embrace the guidelines that exist out there. We made a major step yesterday between the city council and the administration to give the ability to have outdoor dining, so that you don't have to break the social distancing rule.
When you look at the funding for your business community, the city now has provided some grants as well as money coming from the state and nationally. Do you think that enough is coming in to help these businesses reopen and hopefully stay in business?
Well, I think that's going to be an individual based on an individual case for each business. There's some businesses that would tell you, that they are grateful for what they've gotten and that it's going to help them to restart and that they should be fine. There are going to be others that say, I haven't gotten anything, I don't know how I'm going to get it, and I don't know how I'm going to really reopen. So there's a range of the impact that it's had. But our federal government has printed a whole lot of money to try to stimulate this economy, and I'm really concerned about what is going to be the impact if they continue to do that, because the outcome ultimately is that we will pay a price for that.
When you say that, a price from which perspective?
From the perspective is that when you print as much money as been printed in the last, let's say month or 6 weeks, and it's kind of a giveaway program, that's it's different than how our economy generates wealth and then generates what I think is the backbone of the economy. So I'm just concerned that we have lost. Politics has gotten involved. It's an election year. Everybody wants to outdo somebody else, to make sure that they maybe get votes. And so I'm just concerned about it.
When you look at the employees, do you think that they've been given enough assistance and help to be able to be prepared now to hopefully go back to work here?
Some have and some have not. Again, it's a whole range, and I don't know how you fill some of the cracks where some of these employees got dropped through. It's just a very difficult situation. And the program that we started with the city, we had certain parameters that you had to meet in order to get the money from the city, and so many of them didn't have business licenses. And many of them had gotten PPE, and so there are going to be some that drop through, but that's just, unfortunately, that's just how it is.
As we look ahead, Mayor Stimpson, 30 days from now, taking into consideration the loss of tax revenue as well as our tourism industry, the Civic Center and Convention Center events that were scheduled, where do you see Mobile 30 days from now?
Well, fortunately, we've gone into this in a very, very strong financial situation, and I think comparatively to maybe other cities that we're going to come out this very strong. I think that we will get some money that'll come through the CARES Act, and it'll make up for the lost revenues we have. And so I know that we will make the adjustments necessary so that we can maintain a strong balance sheet and doing the right things that we need to do by way of our employees and by way of what we need to do taking care of our citizens.
Mobile Mayor Sandy Stimpson, we thank you so much for being a part of the discussion today, and we will be in touch for further updates as we all fight this COVID-19.
Thank you, Eric.
Mobile County Commissioner Merceria Ludgood, also a member of the United Command, along with Mayor Sandy Stimpson. She joins us after this break when Perspectives continues. Our guest this morning is Commissioner Merceria Ludgood for the District 1 in Mobile County. She joins us now as we're talking about an update on COVID-19. Good morning, Commissioner Ludgood. Thanks so much for joining us this morning.
Good morning.
As we look at where we are now in another month of this here in our area and of course in our nation and the state of Alabama, Mobile County now leads continuously now for a few weeks the state in both the number of diagnosed cases. We're now over 1,500, as well as unfortunately 100 deaths almost here in the state, in our county I should say, and nearly 200 residents are hospitalized. Did you, as one of the county officials and leaders, see this coming? And exactly how long ago did you all feel that we could be one of the hardest hit counties in the state?
Well, we did not expect it. I think what we really expected was the margins to be close to population. Like I never expected us to move ahead of Jefferson County, for example, because its population is so much larger than ours. So I don't really think we saw this coming.
As you talk to your county health officials and doctors and scientists, what are they telling you is the reason why Mobile County has had such a high incidence of this COVID-19?
I don't think we know. And I'm sure you're going to talk to Dr. Eichel and representatives from the Mobile County Health Department. They're doing the analysis of what we're seeing, and I think that they could speak better to that.
When you hear the numbers about the surrounding counties, of course, there's an incredible difference in the closest one where they're barely over 200 and some, and then the smaller counties around Mobile County, one as few as 15. Any thought about why that's taking place?
I think there is a correlation between the number of people being tested and the positives that we're getting. When we weren't testing very much, our numbers were lower, but the more we were able to test, then we were able to see greater numbers. And I think what you may see as the testing becomes more available and a lot of these smaller areas have access to tests, that their numbers may begin to rise as well. But there is a correlation between the number of testing and then the number of positives that you're getting.
When we hear some of the numbers being broken down around the nation, one of the things that seems to be coming up in a lot of places, not just here in the state of Alabama or in our county, but the higher percentage of different sectors of the community. In case in hand for many, the African American population experiencing more or a higher percentage than they are, say, of an area where in Mobile County they're showing now about 45% of the people diagnosed are African Americans, but yet the community does not make up that percentage of the county. And then women are now nearly 60% of the county, where in some places it was thought that men were more susceptible to COVID-19. What are we hearing as it relates to that here in Mobile County?
Well, I think what we hear is the same thing we're hearing nationally, and that is the presence of what they call comorbidities among African American populations. I'm not as sure if that is the same with women, but with African Americans, things like we have a higher incidence of hypertension, cardiovascular disease, diabetes, obesity, all of those other health issues are now playing out to more negative outcomes among African Americans with the disease.
When you look at this as a part of the county leadership, are anything new taking place to try and educate the population base at this time as we go through this COVID-19 pandemic?
You know, every opportunity we get, we're talking about the things you need to do to protect yourself. The county has its Be a Hero Stay at Home initiative, where we are distributing signs throughout the county, just encouraging people to stay home. If you don't have to go out, just go out for the necessities, to avoid large gatherings, just to be sensible and to live, really act defensively to protect yourself and to protect those people around you.
You mentioned earlier about the number of tests available. Do you feel that the county has that available now throughout, to where if a person wants a test, they can get tested?
Yes, we have far more supply now, and the Mobile County Health Department is now testing anyone who wants a test, whether they have symptoms or not. Before, when there was a limited amount of testing, it was restricted to people who had symptoms. Now, all you need to do is to make that phone call to the health department, and you will be able to get a test.
What are your thoughts on what's taking place now with the governor changing the stay-at-home orders, and we're now seeing restaurants and hair salons and barbershops, some of those personal one-on-one type situations being reopened? You have any concerns about what may happen in Mobile County, since we are experiencing such high numbers already?
Well, my concern is that people are going to read this as if we are past the threat, that COVID-19 is no longer a threat to the community, and then begin to act in ways that that place them in jeopardy. That's my fear. I walked through the mall. I was doing my 5,000 steps yesterday, and as I walked through the mall, I was just really surprised at the number of people who were there shopping without any kind of face covering at all. So, and I think that as businesses open, that they're going to do what they can, but I'm also concerned that there's not enough masks available in the community for some of these settings, that there's not enough gear for the operators to be able to protect themselves and to protect their clientele. So even though there is a reopening, I think the reasonable thing to do is to continue to be safe to the extent that you can protect yourself as you go into these establishments. Bring your own face covering, wear your own face covering so that you can protect yourself and others, and still go where you have to go, support who you want to support, but do it in a way that's still reasonable, given the fact that we are still daily increasing in the number of deaths, increasing in the number of people who are testing positive. That is our reality. We are reopening, but our reality is our numbers continue to climb.
Commissioner Mercerio-Ludgood, we thank you so much for joining us and sharing that information today. Thank you.
You're welcome.
As we get closer to July, interest in the upcoming runoff elections will really ramp up. And some voters have concerns about their polling places' COVID-19 safety, including social distancing. Commissioner Ludgood addresses that when Perspectives continues. Welcome back to Perspectives. State and local officials have been busy for a few weeks now preparing for the special elections that were moved, you may remember, to July the 14th. Voters may see sneeze guards and their poll workers equipped with masks, gloves, disinfectant spray, and sanitizer. Polling places will also may be moved. Another option for voters is an absentee ballot. Mobile County Commissioner Merceria Ludgood had this response.
One of the things that the county is preparing for is the July 14th runoff election. And a lot of our polling places are small, and we're working now to identify larger sites, but we're also encouraging as many people as can who desire to do so to vote by absentee ballot. And that's a simple process. You request your absentee ballot, and the ballot is mailed to your home. You complete your ballot, and then you mail it back to the absentee office. And you never have to go outside. You don't have to worry about standing in the line or being exposed to other people in the voting process. So pursue the absentee ballot. You can find it at the Secretary of State's website and from Mobile County Probate Court, the absentee ballot applications. They have to be returned by July 9th in order for your vote to be able to be counted on July 14th.
So please keep that in mind. The information, of course, available for how you can download that from your computer from that website as well. Now, there are so many people, places, and things affected by this pandemic. It is a topic that we will continue to talk about and delve into as the local community and the nation try to recover. There are still a number of hotspots in our community, and the concern is that there will be more now that the stay-at-home orders have been relaxed. Coming up next week, we'll be talking with Mobile County Sheriff Sam Cochran and Baldwin County Sheriff Huey Hoss-Mack about first responders and how they're dealing with the effects of the pandemic. And of course, we thank both Mobile Mayor Sandy Stimpson and Commissioner Merceria Ludgood from Mobile County for spending their time with us today. For more information on these topics and how to contact either Mayor Stimpson or Commissioner Ludgood, check out the website information that we have for you that you see here on the screen. And please join us here next Saturday morning at 9 for Perspectives as we discuss those important issues as well as seeking solutions. If you have any ideas of topics that you'd like for us to address, just drop it to us here at perspectives@fox10tv.com. I'm Eric Reynolds. Have a great week ahead.